Welcome back. If it is joined us, you're watching the news at 10, broadcasting on Channels Television live from Lagos.
Airtel, the smartphone network.
Speaking of pictures and videos, here are some pictures sent into our Eyewitness portal. We have 3 photos of fire incidents, one from Anambra, another from Lagos, and the third from Adamawa State, as fire incidents seem to be on the increase in the country recently. We'll begin with this one from Auchi in Edo State, showing people, our Eyewitness reporter says, are members of the Idoha age group cleaning their surroundings. He is asking youths all over the country to emulate such action. We're in Nnewi, which is what you're seeing right there. A picture of a fuel station gutted by fire. Thankfully, no life was lost. Let's head on now to Mafuluku in Lagos, where Eyewitness reporter sent this picture, but did not give details of the cause of the fire, but says the extent of the damage remains unknown. Our last picture is also of a fire incident in Yola, the Adamawa State capital, showing a market up in flames. Our reporter did not indicate the cause of the incident.
Airtel, the smartphone network.
Now, decades of neglect and non-productivity of a potentially huge revenue spinner at the Ajaokuta Steel Company may soon be a thing of the past. And that's because the Minister of Solid Minerals, Dr. Kayode Fayemi, in an interview with our correspondent, Gbenga Ashuru, described the state of the infrastructure as a collective shame to the nation. Dr. Fayemi says the Buhari administration has investigated the revoked concession deal of the company and is working on ways to bring it back to life.
Ajaokuta is a collective shame to all of us. I have investigated. I have been to Ajaokuta myself. I've visited the Takwe mines, which is the associated raw materials producer to the place. And I've studied the papers. Mr. President is very interested. He's even met a whole range of people as far as this issue is concerned. And we have a clearer understanding of the issues as it affects the plant. And we're exploring a number of ways.
What was the terms of reference of this concession deal?
Well, as you said, there was a concession. The concession was revoked. We were taken to arbitration by the concessionaire. And before judgment could be given in arbitration, we asked for an out-of-court settlement as a country. And we entered into negotiations with the Global Infrastructure Company. That's the name of the company that was the concessionaire at the time. And that negotiation produced a modified agreement, which has not been signed before the last government left office.
The Minister of Solid Minerals, Dr. Kayode Fayemi. Let's take a detour now to bring you more on the Yola market fire, which started early this morning.
Smoke billowing into the sky and burning structure is what greeted the residents of Yola in Adamawa State when they awoke on Monday. The market, called Yola Town Market, is situated at the heart of the Adamawa State capital, a few meters from the Emir's Palace, and is popular for the sale of grains. The fire is said to have started around 3 a.m. Some of the traders here are in tears and some can only stare in shock, while others attempt to salvage what they can from the flame. The chief security officer of the market and some of the traders lament their predicament, attempting to itemize their losses.
Very early this morning, at about 3 a.m., I was called by my officer on phone that there was a fire in the market. I quickly contacted the fire department and the DPO Yola. By the time we arrived, the fire had already taken over the market. When the fire service arrived, a lot of damage has been done.
I sell food inside the market, and the other shops belong to my elder brother, and everything has been destroyed by the fire. The market is finished, and I pray that government will assist us because we have lost everything.
Some of the government officials here are also in shock.
Say that this is a monumental disaster. This is a disaster of monumental proportions. This is something we really feel sad about. The main hub of the market is completely destroyed. And then the stores where foods are kept are also destroyed. So you see the multiplier effect is that there will be, apart from increasing the level of poverty within the community, it is also going to challenge food security.
At this stage, we are only trying to contain the happening. And I want to believe you have seen it for yourselves. You have been here, and up to this time, we are trying to see that we limit it to the basic barest minimum we can afford.
The fire has been put out, but the residents of Yola are still reeling from the shock.
A delegation from the Department of Petroleum Resources is visiting the site of the gas plant explosion in Nnewi, Anambra State in southeast Nigeria. The team's mission is to find out the cause of the incident, which left at least 4 people dead. Leader of the delegation, the DPR's Assistant Director in charge of Technical Safety Control, says the team will make its findings public after the investigation.
Charred vehicles and motorbikes, burned tanker and cylinders littering the premises. This is the site of the gas plant explosion in Nnewi, Anambra State, southeast Nigeria. December 24th, a day many residents of
there was a liquid that could not get to the point of flow out. Right? Good. There is no way the compressor will force it to jump into that place. However, because what the compressor is doing one, taking the pressure, taking off the receiving tank into the tank that is offloading. And then the liquid is going on.
If this tank is empty, your pressure relief valve is dead.
Yes.
It's not activated. That means maybe the valve that removes that liquid from the tank was not open. And you are feeling a stationary pressure on it. And that would have made activate the pressure relief valve to move.
It did what it's supposed to do. That's why it invented it and why the thing was just playing.
with the assumption that the incident was caused by the malfunction of the relief valve at the point of discharging gas into the factory's gas tank. The team insists safety standards must be enforced.
We want to ensure that in the downstream sector, people are made to produce a safety case and submit to the DPR for approval. That will entail us to know what hazards you have in the plant and what mitigation methods you have in place to take care of such hazards. These tanks, they have the mineral safety regulations requires them stable time intervals for them to be tested.
The investigation team has assured a speedy inquest, insisting that company owners train their workers on safety measures regularly.
Let's take you now to Abuja, where Yemisi Ikpaya is standing by with more on the news at 10. Hi, Yemisi.
Thank you, Amarachi, and welcome to Abuja. Reactions have been trailing calls for the sale of Nigeria's refineries. This time, a private sector player, the chairman of ICO Insurance, Mr. Dele Fajimirokun, says selling off the plants is a wise idea as the government is not good at successfully running such enterprises. He was speaking on our program, View from the Top, with Modele Sarafa Yusuf.
Refinery, as we have seen, owned by the Nigerian government, which to me still has to be privatized. The government can never be a good manager of any enterprise. They are not set up to be good managers. So the first way is to first sell off what is there, privatize it one way or the other, either through the stock exchange or through what they've done before, selective bidding or whatever they can do, similar to what they did in telecommunications. You will still find buyers for them.
It doesn't seem, there have been recommendations by several committees and by people like your good self that government should sell off its stakes in the refineries. But we don't seem to get an impression that people are beating down the doors and asking to take over this particular refineries that are,
Has the government given an indication of selling? The worst thing a businessman wants to do, I, for one, or we, is to partner with governments in a joint venture like that. Because an experience in this particular area that I have been, my experience there had not been rosy with the last government wanting to take charge of management of the OML 26. And they're simply not capable of doing it. So it's really a private sector, should be a private sector driven business. Governments should just always retain regulatory roles in all these areas, not ownership role. That has always been my prayers.
And now to some stories about health. And it's Lassa fever which appears to be causing a lot of concern for health workers in Taraba State. There are reports about a possible outbreak of the disease, but health officials say it's merely symptoms that they've found among residents in the affected community. The State Commissioner of Health, Dr. Innocent Vakai, says one person has been confirmed dead, although it's not confirmed that the victim died of Lassa fever. However, the Commissioner has confirmed that 2 people are showing symptoms of the disease. Joining us now on the telephone is the Commissioner for Health in Taraba State, Dr. Innocent Vakai. He's talking about the government's efforts at containing a possible outbreak of Lassa fever in the state.
No, what we have is specific cases of Lassa fever. Because usually when you have patients presenting with symptoms and signs that are compatible with Lassa fever, we cannot make a categorical statement and say it is Lassa fever. Not until we take blood samples and take it to the laboratory for confirmation. And the reference laboratory we have in Nigeria, one is the Yola Social Hospital in Edo State, and the other one is the Nigerian Center for Disease Control Lab in Abuja. So currently we have taken samples to these labs, and they have told us that by Thursday we are going to get the results. And that will confirm whether we have outbreak or not.
Now, how many cases do you have so far?
We have 3 suspected cases. One is dead, and 2 are currently being quarantined at the Federal Medical Center, Jalingo. They are under quarantine. That's the standard procedure or standard operating practice when you are managing cases of Lassa fever.
What measures are being taken to preclude a spread in the event that it actually turns out to be Lassa fever?
Yes, usually diseases like Lassa fever are diseases of international concern. The state government has already acted proactively, providing drugs, asthma protective equipment to prevent the health workers from contracting the disease and also the general public from getting infected from people that might contract the disease. And in addition to that, we have activated our surveillance system to the highest level to report any suspected cases also that active measures can be taken. And also the Nigerian Center for Disease Control have assisted the state for the ribavirin, that is the drug we use in the treatment of Lassa fever, and personal protective equipment to prevent health workers attending this patient from contacting the disease.
Now, joining me in the studio to discuss this issue in more detail is the director of the Nigeria Center for Disease Control, Professor Abdulsalami Nasidi. Welcome, Professor Nasidi. Thank you so much for coming on to give us some insight. First of all, what's the current situation with the 2 quarantined patients in Taraba State?
Actually, we have 3 patients now in the hospital, and the whole we had 5 suspected cases of Lassa with all the symptoms of Lassa, and they are all treated at the Federal Medical Center in Jalingo. And what the Honorable Commissioner said is right, and officially we have confirmed that 2 out of these 5 are dead, and 1, death also have not been confirmed whether it is of Lassa or not. So it could be between 2 to 3 deaths. And 1 out of the 2 patients left is doing very well, and the other one is really not decent. But the good news is we have pre-positioned drugs that are required. For Lassa we have only 1 drug that can save life if used early. So that means we have to pre-position these drugs in all the states of the Federation, so you don't need to wait for us to take it there. So as I'm talking to you now, we have the drug which is called ribavirin, and it's been applied. So all those who came early, who caught the disease earlier than 6 days and were brought to the hospitals, have survived.
But this is not the first time this has happened in Nigeria. In 2012, 70 lives were lost in 19 states. Mm-hmm. Why is this still happening in Nigeria, and are we talking about an epidemic?
Actually, even 1 single case of Lassa is regarded by the WHO as an epidemic. But even we in this area are surprised why is Lassa spreading so wide in the country. But we're now conducting survey. We have our experts from the Nigerian Field Epidemiological Laboratory Training Program, jointly with US CDC, with WHO experts, and we're establishing that we are seeing natural effect of what is called global warming, and also the intensive climate change, that are occurring within the African continent, but worldwide.
And what about public awareness? What do the public and health workers need to do as a preventative measure?
First and foremost, the public awareness is, for us to quickly mount health promotion, which we're already doing. This is now led by the new Minister of Health, who has taken it upon himself.
Sorry, we're going to have to cut it short there, but thank you very much.
Okay.
And when News at 10 returns, Lagos government signs budget into law. State authorities say they are ready to roll. That's on Business News. Do join us again.